Hi, my name is Victoria Garcia. I'm going to be performing a head to toe physical assessment with the cranial nerves. So, this is going to be my patient. The first thing that I would do is I would perform hand hygiene. I would don the appropriate PPE if it's indicated, and I would gather all my supplies. So, I have all of my supplies right here, even though you can't see them, they're here. Excuse me. So then after that, what I would do is I would introduce myself to the patient. I would identify the patient. I would explain the procedure and ask them if they have any questions. So I'm going to use this as the patient's arm. Okay. Hi, my name is Victoria Garcia. I'm going to be your student nurse for today. Can I go ahead and see your wristband? And can you give me your full name and date of birth, please? Okay. Everything matches up with my records. So what I'm going to be doing today is I'm going to be performing a full head to toe physical assessment on you to see if there's any abnormalities that we need to be looking for. Do you have any questions? No? Okay. At any point in the procedure, you may feel some discomfort. If you do, please let me know. Just let me know. So then after I do that, I would provide privacy to the patient. And then I would start off with a general physical appearance of the patient. So the patient is alert, oriented, she's responding well to my questions. She looks to be her stated age, body parts, features look to be equal bilaterally. She looks clean, well groomed. She looks to be dressed well for culture and for age also. Her height's a little tall, but I assume that's genetics. Um, she doesn't appear to be in any acute signs of pain. She doesn't seem to be confused. She doesn't seem to be have any shortness of breath, nothing like that. Everything looks to be appropriate for age and for culture also. After I finish up with my physical appearance, I'm going to go ahead and I'm going to check the patient's BMI. So how I do this is I'm going to go ahead and I'm going to weigh the patient. I would take her weight in kilograms and her height in meters squared, and I would divide that to get her BMI. After I get her BMI, then I would assess for pain. So, miss, on a scale of 0 being no pain to 10 being the worst pain you've ever felt, how would you describe your pain? How would you rate your pain? And if so, where? Okay. Okay. So the patient says that her pain is 0. So she's saying she's not feeling any pain. After I've inspected for or assessed for pain, what I'm going to go ahead and do is I'm going to go ahead and inspect the head, her head. I'm looking for is her hair evenly distributed? Are there any bumps? Are there any lesions? Anything like that? So I would palpate her head. Her hair looks to be evenly distributed. Her hair is coarse. I'm not feeling any indents. I'm not seeing any lesions, no bumps or protrusions that we need to be worried about. Head is normal cephalic. After I would look at her head, now what I have to do is I'm going to go ahead and inspect the external eye. And how I would do this is I would inspect, are they equal? They are symmetrical to the face. Her eyebrows are also equal. Hair is evenly distributed. I would check the conjunctiva. So the conjunctiva is pink. There's no signs of inflammation. There's no redness. There's no bumps or lesions. Nothing like that. Her sclera is white and clear. Her pupils are equal. They look to be about a 2-3 in size. Her cornea is also equal. I'm not seeing any discharge. I'm not seeing any exudate. Nothing like that. So now what I'm going to go ahead and do is I'm going to test for cranial nerve number 2, which is her optic nerve. So what I'm going to do is I'm going to have the patient read something for me. As you can see, there's nothing on here, but I'm going to pretend that there is for the patient to read. Can you go ahead and read me the smallest line that you can see? Okay, so that's good. Now what I'm going to do is I'm going to go ahead and test for her peripheral vision. And how I do that is I would put my hands right here and I would tell her to let me know when she can see my fingers. Right there. Okay, and that's about in the line of sight that we want her peripheral vision to be at, and that was cranial nerve number 2, her optic nerve. Now what we want to do is we want to go ahead and assess her pupils. We're looking for Perla, which is her pupils are equal, reactive to light, and then we're going to check for accommodation. This is checking cranial nerve number 3 and number 4, which is her ocular motor and her trochlear nerve. So what I'm going to do first is I'm going to check her pupils. Okay, what I'm doing is I'm checking for a direct response, and then I'm going to test for a consensual reflex. That's the word. Okay, and the first time I'm looking for a direct response, and I'm looking at the pupil, making sure it constricts. The next time I'm going to be looking at the other eye to make sure that the other eye also constricts. That's called the consensual reflex. Okay, and I'll do that with the other eye too. Okay. Both of them appear to be normal, both cranial nerves number 3 and 4, which is your ocular motor and their trochlear nerve. The next thing I'm going to do is I'm going to go ahead and test for accommodation, which is the A in Perla. So what I'm going to have the patient do is I'm going to have the patient look at a painting that I have over there, and then have her look at a handheld object. So I would have the patient look first at a faraway object, make sure that her pupils dilate. And then I'm going to have her look at a handheld object to make sure that her pupils constrict. So can you please go ahead and look at that painting for me? And now at my pen. Painting. Pen. Okay. Accommodation was good. Now what we're going to do is we're going to test for cranial nerve number 6, which is her abducens. Yeah, cranial nerve number 6 abducens. And we're testing for extraocular motor. This is their 6 cardinals of gaze. So I'm going to go ahead and test for that. So can you please follow my pen with your eyes? Okay. Cranial nerve number 6, abducens, seems to be working just fine. She was able to follow my pen with her eyes. The next thing I'm going to do is I'm going to go ahead and test for conversions. So how I'm going to do this is I'm going to have the patient follow my finger with her eyes, and I'm going to put it to her nose. Can you please follow my finger with your eyes? Okay, the patient was able to converge her eyes. The next thing I'm going to go ahead and do is I'm going to go ahead and take a look at her ear. I'm going to look first at the external structure, and then I'm going to look at the inside of the ear. I'm going to palpate the external structure first, the pinnae. Okay, I'm not seeing any lesions. I'm not seeing any exudate, nothing like that. Now I'm going to take my pen light, and I'm going to go ahead and look inside the ear. We're looking for foreign bodies, exudate, discharge, cerumen, things like that. I'm going to do this for both ears. I'm seeing a little bit of cerumen, but that's not abnormal. I'm not seeing any foreign bodies. There's no exudate, there's no discharge, there's no lesions, nothing like that. So now what I'm going to do is I'm going to go ahead and test cranial nerve number 8, which is the acoustic nerve. And how I'm going to do that is I'm going to perform a whisper test on the patient. And how I do that is ideally I would be standing behind the patient. I would cover up the ear that is not being tested, and I would whisper and have the patient repeat back to what I whisper. So I would do that here, and then the patient would repeat back, and then I would cover this ear, and then I would say, and I'd have the patient repeat it back to me. This is testing acoustic nerve number, cranial nerve number 8, which is her acoustic nerve, making sure that it's working well. The next thing that I would do is I would perform a Rhine and Weber test. I don't have the tool with me. It's a little wide tool that you would make ring and put on the patient's forehead and have them tell you where they hear it, but I don't have that with me, but I would ideally perform that. The next thing that I would do is I would check the nose. I would don gloves, and I would palpate for the external structure. I'm not feeling any bumps. It feels straight. I'm not feeling any curvature of the nose. The nose also looks to be symmetrical with the face. And now what I'm going to go ahead and do is I'm going to occlude the noses, the nares, and I'm going to have the patient breathe. So I'm going to occlude one side and have the patient breathe out of the other. And then I'm going to do the same with the other side. Can you please breathe? Okay, good. So now what I'm going to do is I'm going to go ahead and take a look at the internal structure of the nose. We're looking for a deviated septum, any foreign bodies, any mucus, things like that. And I would have the patient tilt her head up. Can you please tilt your head for me? Okay, septum is intact. There's some mucus which isn't exactly abnormal. Everything looks to be pretty good.